What if I told you a virus so common that 80% of sexually active people will get it at some point is also the cause of nearly all cervical cancer? It's linked to cancers of the throat, anus, and more. Yet, we almost never talk about it. This isn't a rare foreign threat. This is human papillomavirus, or HPV, the infection hiding in plain sight. Today, we're pulling back the curtain. First, let's demystify it. HPV isn't a single virus. It's a family of over 200 related viruses. Think of it like the common cold virus, many types, all in the same family. We categorize them into two groups. Low-risk types, like HPV 6 and 11, are mainly responsible for genital warts. They're a health concern, but they don't cause cancer. Then there are the high-risk types, like 16 and 18. These are the ones we pay close attention to because over many years they can lead to cancer. HPV spreads primarily through intimate skin-to-skin contact. It's so common that it's considered a normal part of being sexually active. Having HPV is not a sign of promiscuity or poor hygiene, it's a sign of being human. Here's the most important fact to remember, and the source of a lot of confusion. In about 90% of cases, your body's immune system clears the HPV infection on its own, usually within 1 to 2 years. No symptoms, no long-term effects, no problem. It comes and it goes. The problem arises in that small percentage of cases where a high-risk type of HPV persists for many years, sometimes a decade or more. This long-term infection can slowly cause changes to the cells. This is why we call it a high-risk virus. Given enough time, these persistent changes can, in some people, develop into cancer. Now, for the powerful part, we are not defenseless. In fact, we have two of the most effective tools in modern medicine to fight HPV. First, the vaccine. It's a monumental achievement. The HPV vaccine is designed to prevent infection from the most dangerous high-risk types and the main wart-causing types. It's most effective when given before a person is ever exposed to the virus, which is why it's routinely recommended for adolescents, but it can also benefit many adults. Talk to your doctor. The second tool is our safety net, regular screening. For cervical cancer, this is the Pap test, or smear, and/or the HPV test. These tests don't prevent the virus, but they are brilliant at catching those slow cell changes early, years before they could ever become cancer. Think of it this way. The goal isn't just to find cancer early, it's to find the precancerous changes and treat them with a simple procedure, thereby stopping cancer before it even starts. So, let's recap. 1. HPV is a common family of viruses. Having it is normal. 2. Your immune system is a superhero and clears most infections. 3. We have a vaccine to prevent it and screening to catch any problems so early that cancer can be prevented. Your action step? Have a conversation with a healthcare professional. Ask if the HPV vaccine is right for you or your children, and what the recommended screening schedule is for your age and gender. Your health is in your hands. If this clear breakdown helped you, please like this video and subscribe for more. Hit the bell to not miss our next guide to understanding your health. Thanks for watching.